Hello, my name is Teresa Brannon. I am the Manager for Training and Technical Assistance at the National Center for Health and the Aging, a project of North American Management. Thank you, and I welcome you for attending today's webinar, Falls Prevention, Practice Made Simple Through Community Resources. This webinar was made possible by grant number U30CS22743 from the HRSA Bureau of Primary Health Care, and its contents are solely the responsibility of the authors and do not necessarily represent the official views of HRSA. This webinar is being recorded, and the slides will be emailed to you after the webinar has finished. There will be a question and answer session at the end of the presentation. I would like to talk a little bit about what the National Center for Health and the Aging does. We maintain, we have main initiatives focused around the following items. We establish collaborations with national and state aging agencies. We conduct needs assessment with health center programs and lookalikes to determine primary medical care service, any kind of delivery needs that the grantees that they need to serve the elderly. We provide an annual National Primary Care Symposium on aging, and we also offer remote, on-site, and one-on-one training and technical assistance and peer monitoring, and we conduct a new HRSA BPHC grantee training and orientation call. We develop protocols and tools to help grantees that serve the aging population, and we provide knowledge of health literacy and skills necessary to reading, understanding, and acting on basic health care information. And we facilitate outreach to seniors. The next slide shows our 9 developmental strategies that we provide to grantees that help the underserved elderly population. And just to give you a little bit more about the aging population, people or individuals that are 65 years and older are represented about 12% of the population, the U.S. population in the year 2000, and are expected to be 19% of the population by 2030. So the health and wellness of the elderly population is really important, especially with the baby boomers. I think the estimate is 70,000 baby boomers turn 65 like every day. So it's important that appropriate policies be created to address the specific needs of the elderly population, such as the public health aging policy. And now I'd like to discuss our honored, I'm honored to present the presenters for the upcoming webinar. Ms. Lynn Beatty, who is the Vice President, Injury Prevention for the National Council on Aging, is working on many national projects to reduce falls and fall-related injuries in older adults. Most notably, she is leading the National Falls Free Initiative, including a national coalition and the growing 42-member state coalitions on fall prevention work group. She also convenes the CDC Experts Panel of Physical Therapists in Fall Prevention, advising both CDC and APTA. Achievements include passage of federal legislation, increases in federal investment in falls prevention, and annual Senate proclamations of Fall Prevention Awareness Day. Lynn is a physical therapist who retired from the Army Medical Department as the Chief Physical Therapy Section and joined NCOA in 1999. She has her undergraduate degree in health and physical education and master's degrees from Baylor University in physical therapy and in healthcare administration. In 1998, she completed the master's level gerontology certificate program at the University of Maryland before joining NCOA to promote healthy aging. Dr. Mindy Oxen-Renfro from the School of Physical Therapy and Rehabilitation Sciences at the University of Montana, Missoula, Montana, and co-lead of the Montana Fall Prevention Coalition. Mindy worked with the CDC expert panel on falls and continues to work closely with that group's physical therapy work group. Her doctoral work was an interdisciplinary study including public health, geriatrics, and physical therapy. Her area of study is in fall risk assessment and dissemination of evidence-based programs for fall prevention. And Ms. Ellen Schneider is a research scientist at the University of North Carolina Health Center for Health Promotion and Disease Prevention. Her areas of focus include falls prevention, healthy aging, and evidence-based health promotion. She has worked extensively with state health departments, the CDC, and the Aging Services Network to build infrastructure and implement falls prevention policy and programming. On the state level, Ellen co-leads the North Carolina Falls Prevention Coalition and is a dissemination leader with the Carolina Geriatric Education Center to build North Carolina's falls prevention infrastructure and support efforts to link clinical practice with community-based services. I turn over the presentation to Lynn Beatty.
Well, thank you very much. I appreciate that, Teresa. And we're really happy to be here and to present to you some of our thoughts about falls. It's a very complicated issue, but it can be made more simplified through a team approach. And although this looks like a lengthy list of 7 objectives, you'll see they're really all interrelated. And it's designed to promote awareness of the issue, bring further awareness of some new tools and resources you can employ out in your clinics to address this growing public health issue. And also talk to you a little bit about why it can be cost effective to incorporate those tools into practice. And finally, what community assets are available that can help you in referring your clients out for other services. It really can be simplified by a team approach. But let's start off with the question of why. What's the big deal when so many of your patients now have so many other concerns and multiple chronic conditions, geriatric syndromes? Why are we looking at falls now? Well, one of the big things is trying to bring more awareness because it's a huge issue, as you will see. And Sunday is the 6th annual Fall Prevention Awareness Day, and we have 47 states that are participating, and I hope that you're aware of that and maybe even participating in some of the events. But let's look at the etiology, or epidemiology, I'm sorry, of falls. As you see, more than 1/3 of adults fall every year, but that really results in about 2.3 million older adults showing up at the emergency departments every year with all manner of fractures and soft tissue injuries and head injuries and such. Of the deaths that you see, it's the leading cause of injury deaths in older adults, but that equated to 21,000 deaths in 2010. And those rates are going up, and many of those falls resulted in traumatic brain injury. Looking at the outcomes to falls, 20 to 30% of falls result in an injury. So you might think, well, that's not a big deal. But the magnitude and the percentage increase by age, and we know we have an aging population. If you look down to the 4th bullet, you'll see that people who are 75 plus are more likely to fall 4 to 5 times more likely and to be admitted into long-term care. And we always hear about things like hip fractures. Well, for hip fractures, 1/4 of all hip fractures are still in a nursing home a year later, so it's extremely expensive. And also of those hip fractures, 20% are dead within a year. So this is really important to kind of get our arms wrapped around the fact that falls are largely preventable through risk management. Now, of course, all of those numbers add up to a huge cost. Any of you that are looking at your slides right now on that last bullet, those of you who may have printed them off ahead of time, I changed the figure. It's actually 59.6 billion. On the original slide, it was 54 billion. It's going up, but essentially it's $60 billion by 2020 will be spent on falls. And this is really mostly direct healthcare costs. It's not the cost to you as a caregiver, to your employer. It's not the cost to families. It's not the cost, all the other indirect costs that are associated with it. Next, please. And you can see some of those personal costs on this slide. And about 1.5 million grandparents are primary caregivers for their grandchildren. So if grandma falls and breaks a hip, now you've really affected a whole community. So it's an important piece to think about. Falls place, as it shows, a financial burden on the individual, their families, and actually whole communities, because older adults are often sources of volunteer hours. They drive each other places, you know, peers, friends. They help each other in communities, and now all of a sudden that is lost. Next slide, please. And just to share, there are a lot of old people. I'm a baby boomer. Those were my parents. the census tells you in 2011 that we had over 1.9 million people were 90 plus, like my parents. I had mentioned earlier they have 4 to 5 times more risk of falling. They're more frail. There's more osteoporosis. Often there are multiple chronic conditions. They're taking many medications. They have a variety of functional losses. Attitude and engagement. They can be depressed, which is another risk factor and shouldn't be. That's not a normal stage of aging. And then level of cognition. We know we have all forms of dementia and Alzheimer's. And so to think about another partner that you can reach to is the caregiver and the family. We're working very hard around Fall Prevention Awareness Day and throughout the year to bring some of those skills, responsibilities, and strategies to caregivers as well. But now let's let Mindy take it away and let her talk about what you can do to help make a dent in this growing public health issue. Falls are not something to fear, they're something to manage. Thank you.
Thank you, Lynn, and thank you all for joining us today. It's an issue near and dear to our hearts, and we're very glad that you took time out to hear about it. I'd like to speak with you today about the CDC's new user-friendly, evidence-based fall risk screening tool called the STEADY. STEADY is an acronym standing for Stop Elderly Accidents, Deaths, and Injuries. We all agree that we must identify those older adults with a heightened fall risk. However, we know that time and staffing in medical practices today is limited and very costly. STEADY provides an efficient and cost-effective answer. Next slide, please. Before we can ask about falls, we have to be clear both between ourselves and with our patients what exactly we are talking about. A fall is defined as any event that leads to an unplanned, unexpected contact with a supporting surface. For example, if you stand up out of a chair and fall back into the chair when you meant to walk away, that's a fall. If you lose your balance and are caught by someone near you, that is also a fall if you would not have regained your balance on your own. It does not have to be to the floor, and it does not have to result in injury. Before you discuss falls with your patients, explain why you are asking, because it's such a common event, and then define for them what a fall is. Next slide, please. We know that falls are multifactorial fall risks. Falls are caused by many risk factors. Different risk factors are at play for different people. Each person's risk factors are based upon their individual factors, and each person's fall prevention program must also be tailored to their individual needs. One size does not fit all. Next slide, please. There are many key risk factors that you can see listed up here that you are most likely aware of. Key risk factors are both intrinsic to the individual and extrinsic to the environment. Some risk factors are abatable or modifiable, while others are not. We can't change our age, and we certainly can't change our gender. Falls are a multifactorial event. A history of falls is the #1 predictor of future falls. Along with a history of falls is polypharmacy, lack of physical activity, vision issues, dizziness, use of an assistive device, fear of falling, home safety, depression, etc. Next slide. In 2009, the AGS-BGS guidelines were posted and are thorough and helpful, but not user-friendly. They go on for 4 or 5 pages on the web, and although they are very comprehensive, it's very difficult to adopt all of them. The CDC set out to discover how the guidelines could be made more useful to primary care practitioners. The study was created based upon the AGS-BGS guidelines, using interviews, focus groups, and surveys of various practitioner groups. Next slide, please. And the study was posted about a year ago now, and I'm hoping that some of you have seen this. We were going to go through in great detail about the study, but there is now a webinar online at the website up on this slide that you can access. So we will go through some of it, but if you're looking for more detail, please enjoy the webinar. So what's in the toolkit? The toolkit contains provider resources, training materials, and patient education brochures. By providers, CDC was not pointing just to physicians, but to all primary care practitioners. Next slide. The Stay Independent brochure is where you start out with the study. It is a validated self-risk assessment instrument that patients can complete in the waiting room or at a public health fair or at a fall risk screening. It's a quick way to identify a patient's major risk factors for falling. Not all of them, but some of the important ones. There are also instruction sheets in the study toolkit for 3 gait and balance tests and 1 on measuring orthostatic blood pressure. A fall risk checklist is also included. This is where the findings from the risk assessment and the balance test can be entered and looked at all at once. Next slide, please. So what you may want to do is have all of your patients over the age of 60 or 65 be given the Stay Independent brochure while they're waiting in the waiting room, and they will complete the questionnaire inside. Next slide. This is the inside of the Stay Independent brochure, and you can see there's 12 simple questions that you answer yes or no. The 2 at the top are weighted as 2 points, all of the others are 1 point, and you add up all of the yes answers. And the practitioner will go through these answers during the visit and find out the root of the fall risk. Next slide. Based upon the score on the Stay Independent questionnaire or based upon your office practice, you will then have somebody administer the timed up and go, the 30-second chair stand, and the 4-stage balance test. These evaluations have been modified slightly to be user-friendly in the medical office by any trained individual. They do not have to be done by the practitioner themselves. There are also instructional videos that are brief, and you can see these tests being done on the study website. Next slide, please. Instructions for measuring for orthostatic blood pressure are included in the study because orthostatic hypotension can be a cause of falls. Orthostasis is defined as a drop of 10 millimeters of mercury in diastolic or 20 in systolic blood pressure when a person changes position. Next slide, please. And this is the fall risk checklist. In most offices, the patient would complete the questionnaire in the waiting room, would complete the balance test while they're having their blood pressure checked, and then come in to see the practitioner. And the results of those tests would be outlined on this fall risk checklist to be reviewed with the practitioner. Next slide, please. The practitioner would then go through and respond to the yes questions and decide with the patient what the best course of action is to decrease the risk indicated by the yes responses. For instance, item 1, I have fallen in the past year. Previous falls, we know, are the #1 predictor of future falls. This would require a detailed assessment of those falls and their circumstances. This could be done by the practitioner and or by referring the individual to a PT for evaluation and treatment. Next slide. So again, how does this flow? The patient completes the Stay Independent questionnaire in the waiting room, or if you send your documents to the house to be completed prior to the visit, this could go along with them. Balance tests are completed by the medical assistant when vital signs are taken. The study is scored, and the summary sheet is placed on the front of the medical record or in the EMR by the medical assistant or the nurse. The practitioner reviews the results and plans the interventions with the patient. If there is not time at that visit, a follow-up visit can be arranged. Next slide, please. When you go over the results, you want to carefully review each yes item. Consider the balance tests. The 30-second chair to stand would, if you could not pass that, it would indicate a decrease in lower extremity strength. The 4-step balance test would indicate a problem with balance, and so on. Anyone scoring greater than 4 or greater on the steady should be referred to the best evidence-based fall prevention program. And we'll talk about those in a minute. And you always want to provide fall prevention education to everyone, regardless of their score. Next slide. The study includes the very common, you've probably seen the CDC brochures, what you can do to prevent falls, check for safety, which is a home safety checklist, and a newer pamphlet on postural hypotension, what it is and how to manage it. All of these can be ordered or downloaded at the CDC website. Next slide, please. So why would PCPs use these measures, and can you get reimbursed for them? Yes, you can. If you're familiar with the PQRS, which stands for the Physician Quality Reporting Initiative, it provides financial incentives to primary care practitioners to assess fall risk. If you're familiar with this system, it is items 154 and 155 that relate to assessing fall risk in your outpatient practice. A falls risk assessment is also an element of the Welcome to Medicare examination, or the initial patient preventive physical exam. The initial annual wellness visit also requires a review of individual functional level and safety, including falls. So there are many incentives in the Medicare system to include the study in part of your practice. As you probably are aware, in another year and a half, the PQRS system will no longer be an incentive program, and there will be decrease in reimbursement if you are not part of the PQRS system. Next slide, please. So what do we do now? Now that we have this toolkit, the challenge will be first to find ways to introduce providers to the materials so they can incorporate fall prevention into their clinical practice. It's important to start to work with your entire office staff to create the referral and resource pages for your community. Knowing that someone has heightened fall risk is a good first step, but you also have to know what resources are available to refer them to. So you might start by locating your evidence-based fall prevention programs and also your other professionals in the area for referral. You can find your area agency on aging at www.eldercare.gov, and Ellen will speak to that a little bit more later. Next slide, please. Now what? You've determined that a person's fall risk is elevated and you want to send them off to an evidence-based fall prevention program. You have your resource list. You know the names of the programs. Which one do you choose, and how do you decide? We'll talk about those briefly. Next slide, please. We know that it takes more than 50 hours of balance exercise just to reduce fall risk, let alone maintain a reduction in fall risk. The minimum effective dose would be 2 one-hour sessions per week for 25 weeks. That's a long program. Achieving long-term exercise participation by combining supervised group exercise with follow-up home exercise programs is absolutely critical. And as the PCP, following up with the patient and making sure that they are continuing along is critical. Next slide. So what type of training is better? Do you prescribe a one-on-one program or a group class, and how do you decide? If your patient is just recovering from a fall or other injury, illness, or surgery, it may be best to start with physical therapy in the home. If you feel they need one-to-one attention, in the group class situation, patients need to be able to engage in exercise in a group without one-to-one supervision. You may decide that due to problems with hearing or vision or balance or incontinence or cognition, that group work would not be good at this time. Or simply a group class is not available in your area. If those things are true, you may want to begin with physical therapy, and you may ask them to include Otaga exercise program in their service. Many people, however, will be able to benefit from a group class in the community. The group classes include education, behavior change, as well as the physical exercise, and the group process can be very important. If they are able to hear, see, learn, participate with a group, they should probably be referred to a group. If they can safely get to a community-based class, or perhaps they've come in and they have now completed Otago with a physical therapist and they're ready to move on, a class is a good place to go. The evidence-based fall prevention is available in the area and is accessible. You should probably use it. Now let's talk about stepping on or matter of balance and others that might be available. Next slide, please. So what is Otago? Otago is a town in New Zealand where this program began. It's an evidence-based fall prevention program that is individually tailored, home-based, and includes balance and strength program, and it's delivered to frail older adults over the course of a year. Exercises are selected from a menu and progressed along a predictable path, first by the PT and eventually by the patient and/or their caregiver. It does include a walking plan as a very important part of the program, and therefore when you prescribe Otago, you should probably be thinking about, will this person be a safe community ambulator? The programs require a minimum of 7 home visits and 7 phone calls that are done by the PT and/or the PT staff over a year. Falls and injuries have been shown to decrease by as much as 35%. Next slide, please. Who benefits from Otago? Well, everyone benefits, but the population that benefited the most were adults age 80 and older. And Otago, I need to stress, is delivered in the home or when someone is going to be in the home. Next slide, please. And, okay, how primary care providers make referrals. The PCP screens the older adult. They refer to PT with a diagnosis such as balance or gait impairment. Use the V15.88 code for fall prevention to help with reimbursement, and can include in the referral to the PT, please consider Otago. PTs can receive low-cost Otago training at this website. Just takes a couple of hours and they can be on their way. Next slide, please. Group classes. Most evidence-based fall prevention programs include 8 to 15 older adults in a group setting in a community location. This requires that the participants get out into the community to register. It requires transportation, and they have to be able to get in and out on their own. It provides social interaction, which can be motivating. The day, time, and location are critical to consider. If a person is unable to get to the location or they don't like the location, they will not participate. It's very important to choose the right place. Next slide, please. Matter of balance and stepping on. These are two of the programs that are being disseminated broadly. They are similar, and a lot of people wonder, which one do I choose? Matter of balance is known to reduce fear of falling and associated anxiety using a peer leader facilitated class. The exercises begin at a seated level, and it's much simpler than the exercise regimen in the Stepping On class. Stepping On is known to reduce falls and also utilizes leaders with peer co-leaders when possible. Exercises progress from the Otago program. Balance exercises begin in standing. Both programs use expert lectures to promote education, such as PT, OT, pharmacy, emergency personnel, etc. Next slide. Matter of balance classes are designed to benefit community-dwelling older adults who are concerned about falls, and concern is the big word here, have sustained a fall in the past, restrict activities because of concerns about falling, are interested in improving flexibility, balance, and strength, and are age 60 or older. The classes meet 2 hours a day, once a week, over 8 weeks. Participants learn to view falls and fear of falling as controllable. Next slide, please. The interventions in Matter of Balance focus on changing misconceptions, the biggest one being, if I just sit in this recliner and hold on and watch TV, I will decrease my risk of falling because I can't fall when I'm in the recliner. Of course, we know that physical inactivity will result in heightened fall risk, and that's one of the things stressed in Matter of Balance. MOB also teaches skills that promote self-confidence in one's ability. The Stepping On improves self-efficacy to change the behavior through telling stories, discussion using prevention framework, doing homework, and multiple modalities to learn. Stepping On is also a community-delivered group course for older adults that includes a series of lectures, exercises, and group discussions. It meets for 7 weeks, 2-hour meetings once a week, and also utilizes content experts with their trained leaders. The exercises are a progression from those in Otago. The Stepping On content is similar to Matter of Balance with less emphasis on the fear of falling. Balance and strength exercises are done at each session, as well as monitoring their home progress. Balance and strength exercises at home to reach effective levels of exercise, and progressing exercises as able. It's very important as a clinician referring to Stepping On to realize that it is critical at the end of Stepping On to meet with your patient again and progress them along into another activity. Next slide, please. sorry, I hadn't progressed that one more. Thank you. Tai Chi Moving for Better Balance is a great program to follow stepping on. Tai Chi Moving for Better Balance is best delivered after either stepping on or matter of balance. It was developed at the Oregon Research Institute in Eugene by Fuzhong Li. It's a simplified 8-form format of the standard Tai Chi. The group program is at least 12 weeks, 2 to 3 times per week, and the YMCA is working with the Institute to disseminate this program. Be careful, however, if your patient needs an education component that is not part of the Tai Chi class, and you would want to begin them in either stepping on or matter of balance and then move to Tai Chi. Next slide, please. Tai Chi Moving for Better Balance is offered in many community settings. It can decrease the number of falls, fall risk, and fear of falling. It is slow, low-impact movements that emphasize weight shifting and postural alignment. And it's very, it could also be used with a younger group in the 50s and 60s to prevent fall risk. Next slide, please. So where do I begin? You want to start with fall prevention, but you've heard an awful lot of information. Where do you find out what's in your community, and how do you get started? And Ellen is going to come on and help you find all the resources and get started. Thank you very much.
Thank you so much, Mindy, and good afternoon or good morning, depending on where you are. As we've heard from Lynn and Mindy, older adult falls are a huge public health issue, and it might be overwhelming to figure out how to get started to address the issue. So I'm going to give you a few ideas of next steps and resources for advancing your fall prevention efforts. Next slide. Next slide. Oh, there we go. Okay, the best place to get connected with others who are working on fall prevention would be your state Falls Prevention Coalition. And the National Council on Aging created an interactive map, as you can see here in this slide, to obtain an overview of what your state is doing about falls. So to see the map, just go to ncoa.org/falls map, click on your state, and you will see the coalition overview and contact information for your state Fall Prevention Coalition lead. Now the grayish states on the map have some activity around falls, but may not yet be coalescing around the issue. Next slide. Another good way to connect with fall prevention initiatives in your area would be to contact your local aging services provider. All states have a state unit on aging, and most states have area agencies on aging. Now, to locate a state and or area agency on aging, and those are also known as AAAs, start by clicking on the link in that first bullet and then selecting the state, your state, from the drop-down list. And then you can just drill down from there to your area. And the second bullet on the slide is for our aging services contacts for the Elder Care Locator, which is a public service of the U.S. Administration on Aging that connects you to services for older adults and their families. So you can visit the Elder Care website, or you can call them at the number on your screen. Next slide. Now, I want to briefly show you this graphic of the Aging Services Network that's in place in our country, since many people aren't aware that it even exists. The U.S. Department of Health and Human Services houses the Administration on Aging, which in turn provides funding to 56 state units on aging. Every state and U.S. territory has a state unit on aging. And then the state units on aging support area agencies on aging that I just mentioned. And you'll see that there are 629 AAAs in the country. And then the AAAs then support local service providers such as senior centers. And the Aging Services Network is a great place to build your clinical community connection. And they will often know about what evidence-based fall prevention programs the ones that Mindy just talked about, are being offered in your area. Next slide. Older adults themselves can be engaged, educated, screened, and of course enrolled as participants in fall prevention programs. An example of great places to engage groups of older adults include senior centers, congregate meal sites, faith-based organizations, RSVP and senior corps programs, and older adult learning institutes, just to name a few. Next slide. We also wanted to give you websites for some of the tools that Mindy mentioned earlier. The website for the STEADY toolkit and the CDC STEADY training videos are on this slide, and we also recommend that you develop resource lists for your own area, or again, contact your state Falls Prevention Coalition or aging services providers for resources. Our sincere hope is that you will unfold or strengthen fall prevention initiatives in your own practice management. And for more information on falls prevention, visit NCOA's Center for Healthy Aging Falls Prevention site, as shown on the screen, and that's fully available for your use, and you can download materials from there. Next slide. Now, as Lynn had mentioned earlier, we wanted to make sure that you're aware of Falls Prevention Awareness Day, which is held on the first day of fall. And this has been a successful national strategy for bringing attention to this matter since 2008. And with our partners, we have successfully worked with the U.S. Senate to pass an annual Falls Prevention Awareness Day resolution. And we do this by bringing attention to the impact of falls in senators' home states and what states individually and collectively are doing to address this issue. This year's theme, as decided by the State Coalition's Committee, is Preventing Falls One Step at a Time. And the theme seeks to unite professionals, older adults, caregivers, and family members to play a part in raising awareness and preventing falls. And again, we have 47 states who are planning to participate in Falls Prevention Awareness Day, and we hope that you're part of that effort. It is coming up this coming Sunday, the first day of fall on September the 22nd. And we do collect resources and tools and post them for liberal sharing. So to find those tools and resources, check out the webpage at ncoa.org/FPAD for Falls Prevention Awareness Day. Next slide. We thank you for your time and attention and appreciate all that you're already doing to support falls prevention in your practice or organization. And we'd like to open the webinar for questions now, but if we don't have time to address your question, please feel free to contact us at the email addresses listed. And now I'll turn the webinar over to Teresa, who will field any questions. Teresa?
Thank you very much, Lynn, Mindy, and Ellen. That was a great presentation, and it was a lot of great information on preventing falls. I know that I almost tripped yesterday, and I really need this webinar today. So if anyone has any questions, please feel free to please send your questions either through raising your hand or through the question box. And then at this point, let me see if there are
Teresa?
any. Yes?
Teresa, this is Lynn. I would just like to share, because we had so many resources and links that were in our slides. We have also posted with the slides a resource list. So there's a couple of pages there that have all of the links to include to the STEADY components, to the program components, excuse me, to the area agencies on aging. So all of those are in a nice Word document that staff can download and have access to, because we know that there's a lot there.
Oh, okay. We did have those. I do have those handouts that you sent, and I will make sure that everyone gets those resources that you just mentioned.
Thank you. I think that would be really important, because we want to make it easy. Most people don't know all those resources are out there, and it can be overwhelming.
I absolutely agree, and I will make sure that when we send out the a thank you to all the participants that they definitely have that resource material attached with the PowerPoint slides as well.
I think the other piece too, while you're waiting for questions, is there was a brand new set of guidelines that have been put out now by CDC, the Injury Center around falls, also recognizing a couple of other Tai Chi programs, which heretofore they have not recognized at all as being effective for falls. So one of the ones that may be in the community, because it's been promoted widely, is the Tai Chi for Arthritis program. What the Injury Center is now really focused on is there has to be the 50 hours of balance that Mindy mentioned over the time frame. And so Tai Chi for Arthritis, which is the Paul Lamb program, is around in a lot of communities, and that too was thought to be effective for balance training and will make an impact on falls prevention.
Excellent. I do have a question for Mindy here. It says, could you please review the difference between a fall risk screening and a fall risk assessment or evaluation?
Sure. Good question. Many clinicians think about these tests as fall risk evaluations, and they are used that way, slightly modified from the ones you'll see on the CDC website. A screening is just to alert you that there is a problem without diagnosing what the problem is or giving you great detail about it, as opposed to an evaluation, which is done by a practitioner or physical therapist and gives you the detail when it's used by a practitioner. It's important to understand that the tests that are being put forward but with the study are just meant as screenings and therefore can be done by anyone who is trained in their use. Thanks for asking.
Thank you. That was great. Also, this is for Lynn. Given the data you shared and the aging of the population, we can expect the numbers to soar. So why isn't there more national attention to the issue and more funding for evidence-based fall prevention interventions?
Well, thank you. Well, first off, I should mention that the National Council on Aging, where we sit and promote the Falls Free Initiative, is an advocacy and service organization. And we're concerned with those who are most vulnerable and disadvantaged, many of whom are the clients being seen through the federally qualified health centers and community health centers. And we're all about promoting health and economic security for older adults. So we do a lot of advocacy, and that's why we have Fall Prevention Awareness Day. And as Ellen mentioned, for the last 6 years we've been raising the flag up on the hill, showing, again, if you go to that state map, you'll see what states are doing. We share those with individual senators and representatives and promote the work that's going on and the need for more. And this year we have managed to advocate to get $10 million in the Public Health and Prevention Fund for falls, just to help get these programs in communities and get the integrated approach to this, such that healthcare and aging are seen as kind of a seamless system where older adults can move back and forth and older adults can take on that management issue for their own risk. But it's still a long road, and so any of you who are interested in helping to advocate or have access to your senators, we love your help. You can get to us at fallsfree@ncoa.org. We had this $10 million in the budget the last 2 years, but it was cut at the last moment. We're hoping the third year is the charm, but we can always use more help and more advocacy. That $10 million would go straight into getting more programs and services in the community so that you'll have places to send your clients.
Great, thank you. I have another question. One of the consequences of falls is fractures. I understand some medications, such as Fosamax, have been implicated in fractures. How is this being addressed to reduce fractures after falls?
Mindy, that's got to be yours.
Well, there's an awful lot going on with the osteoporosis medication and the different research studies coming out, and some of them are concerning. We obviously hope that if somebody falls, their bones are firm enough so that they have a decreased risk of fracture with the fall. And anything that we can do to decrease osteoporosis or decrease osteopenia progressing into osteoporosis is critically important. However, there are some mixed studies coming out, and I think we have to, as clinicians, we all have to be watching that and looking at very specific prescription based upon each person's medical history. And of course, we always try to do that, but some of the osteoporosis medications are raising concerns right now.
Thank you. Here's another question. How are you evaluating the STEADY program as far as how many PCPs and what type of PCPs, for example, geriatrics, family practitioner, etc., are using the program?
Right now, the STEADY is being closely studied in 3 states where the CDC is conducting comprehensive fall prevention programs. I am not aware of it being studied anyplace else, and I'm not exactly sure exactly what statistics they are gathering in terms of what kind of PCPs and grouping them that way or not.
Yeah, and this is Ellen. Just to add to that, as Mindy mentioned, it is being piloted in 3 states, although the STEADY toolkit is available to anyone to download and implement. But we're starting year 3 of a 5-year grant to look at STEADY and how to best get it disseminated into physicians' offices or healthcare providers' offices, so we will know more in a couple years.
Okay, thank you. This is for Mindy. Can you clarify if reimbursement is available for completing fall assessment within the Medicare wellness visit and the annual wellness functionality component? Are there additional incentives and or reimbursement opportunities?
Yes, there are. Within the visit, it is in an included component. If there is time within the visit, for instance, you find that there are many fall risk factors and the conversation is going to be lengthy, you can create a follow-up visit using the V15.88 code for the follow-up visit, and it will also be reimbursed under the same guidelines as the annual wellness or the preventive visit. So it's built in to get covered. Okay. And also, if a practitioner is referring to a PT, if you would please not only use the balance or gait code, but then use a secondary diagnosis code of V15.88, it's much easier for the PT to then get reimbursed under the same money stream.
Thank you. One more question. This is for you, Mindy. Who is qualified to perform the STEADY fall risk screening? Who is qualified to review the STEADY with the patient and refer them to the right resources care?
Anyone with an hour or so of training is qualified to do the STEADY, score it, and do the 3 balance assessments. However, the results and the decisions, the clinical decisions, must go to the provider, to the primary care practitioner, to decide what needs to happen and what referrals need to be made.
Okay, thank you.
This is Lynn. Just to add on to that, for Fall Prevention Awareness Day, a number of the fairs and screenings and activities that are going on out in communities are actually trying to use the assessment tool. And if they are finding that there are yes answers, the referral is like, you really need to go speak to your physician or talk to the PT over here who can then refer you to your physician, but that you they're even in a lot of hands of community health workers and people who are helping with these fairs and volunteers. The point is that list, if you look at it, it's not only 12 questions, but it gives a little blurb afterward. Why are these important? And the most important message is to say, you now need to talk to a healthcare provider about your risk. There's something we can do. And the key message to keep in mind is falls are largely preventable.
Thank you, Lynn. Thank you, Mindy, Lynn, and Ellen for a great presentation. Sorry, I think I have one more question. Hang on.
This is Emily, and I actually have a quick question.
Sure, go ahead.
And my question is actually that Falls Prevention Awareness Day is it's coming up this Sunday, and that doesn't leave a lot of time to plan. And I'd just like to ask Ellen, do you have any ideas of what we could do to observe the day with this very little time left? Thank you.
Great question, Emily. Thank you. So you actually, there is time, thanks to some resources already being available. If you just Google NCOA, that's National Council on Aging, NCOA Falls infographic, and it's a great infographic that can just be printed out and put on your bulletin board or downloaded and emailed to your employees, to your clients, or to other listservs to just say, hey, this is Falls Prevention Awareness Day. Here's the infographic is about 6 steps to reduce your falls risk. And you can do something as simple as sending out that infographic. And then another idea would be to download the Stay Independent brochure that Mindy talked about and to distribute that to your older adult clients, again, to any listservs, to other people who, caregivers, so that they can work with their loved ones or the older adults that they work with so that they could actually take a look at their own risk of falling and take that brochure into their healthcare provider when they go in for their next visit if they do turn up some falls risks.
And we should also share that if the first day of fall happens to fall on Sunday, most of the states are doing things on Monday, or states like California and Texas and a few others have a governor's proclamation for the entire week. So it's not just Sunday, and it's actually 365 days a year. So thank you all for all that you do, and please write to us if you have questions. You'll get all the contact information in the resources that will be sent out, or to fallsfree@ncoa.org.
Thank you, ladies. Thank you I'd like to thank everyone for participating in today's webinar. Please complete the post survey. This helps the National Center for Health and the Aging to improve their webinar presentations, future webinar presentations. And I just want to say a huge thank you to Lynn, Mindy, and Ellen. This was an excellent presentation. Your expert knowledge in fall prevention and awareness is absolutely necessary for any caregiver to help the aging population so that we can reduce the elderly having to visit the ERs and that. So I thank you for the great information that you have provided us today. And then I would also like to just ask that to our participants that our website is www.healthandtheaging.org. We have training and technical assistance resources there with webinars, monographs. We have fact sheets, training manuals, newsletters. We have annual symposiums that have presentations from the past year or so that may be helpful to you now. And we ask that you just go and visit our website to see all the different kinds of information that we have. And also, next slide please, just come and join our mailing list and receive HRSA updates, Medicare updates, funding opportunities, senior programs, resources and services, and upcoming webinar announcements. And also follow us on social media, on Twitter. We're always talking with other organizations about how we can improve healthcare for the elderly. So once again, I thank our presenters today for the excellent information that they gave to us. I thank all the participants for attending today's webinar, and thank you to HRSA for making this webinar possible. We appreciate your support to the National Center for Health and the Aging. And if you have any questions, please contact any one of our talented staff members to help you with any kind of training and technical support. Ladies, have a great afternoon.
Thank you, and thanks to everyone for joining us.
Thank you.